Hello everyone and welcome to Ovarian Cancer Australia's Information and Support webinar. My name's Vanessa Alford. I'm part of the support team at OCA. I'd like to begin by acknowledging the traditional owners of the land that we're on and pay my respect to elders past and present. I'd also like to thank AbbVie for providing the funding to deliver this webinar, for which we're extremely grateful, especially during these challenging times. We're so grateful that we can continue to provide resources and to support our women. This webinar will address the psychosocial aspects of living with ovarian cancer. We have three incredible presenters who are going to share some valuable information with you. The webinar is interactive, so over the next hour, you can ask questions to our presenters by using the dark blue hand icon at the top of your screen. Questions will be answered at the end of each speaker's presentation. Please note that presenters cannot address individual medical cases. If you have a particular question, please call the Ovarian Cancer Australia Information and Support line on 1300 660 334. This webinar is being recorded and will be posted on the Ovarian Cancer Australia website. For technical assistance during the webinar, please phone Redback Support on 1800 733 416. So I'm extremely privileged to introduce our presenters to you. Our first presenter is Dr. Jemma Gilchrist. Dr. Gilchrist is a senior clinical psychologist with a special interest in the emotional care of individuals and families coping with cancer. She is actively involved in research to develop new ways of treating common fears and concerns, as well as improving communication between patients and health professionals. She is the founder of the practice Mind My Health in Sydney. In this webinar, Dr. Gilchrist will speak about the emotional roller coaster of coping with the fear of the cancer recurring or progressing, and some strategies to help manage these emotions. Our second presenter is Hayley Russell. Hayley is a support coordinator at Ovarian Cancer Australia and a trained counsellor specialising in cancer care and grief, trauma and loss within a community palliative care context. She's currently involved in several research projects in ovarian cancer, including fear of recurrence. Hayley will speak about maintaining self-care and self-compassion through an ovarian cancer experience. And our final speaker is Claire O'Donnell, who was diagnosed with stage 4 high-grade serous ovarian cancer about 4.5 years ago at the age of 47. She's been on treatment since that time and is currently on a clinical trial. Claire does not put her life on hold because she has cancer and recently travelled around Australia in a motorhome for 7 months, where she received chemotherapy at various hospitals along the way. Claire will share her experience of how she has coped with living with ovarian cancer and how she manages her fear of recurrence. So I'd now like to bring to the microphone our first speaker, Dr. Jemma Gilchrist.
Hi everyone, I'm going to be talking for the next sort of 15 minutes or so, and seeing the next speakers too, I'm kind of keen to hear what they've got to say, particularly Claire and her travelling around. But I'm going to talk about the fear of cancer recurrence. And obviously it's a big topic. We're going to touch on bits and pieces and some ideas, some of which you'll be really familiar with. Others might kind of get your juices flowing and get you thinking about things. So, and you know, of course, we can talk about questions and things afterwards. What I've found since I've been working in cancer care is that the fear of the cancer coming back is something that is pervasive right across all the different cancers. And right across, doesn't matter when someone was diagnosed or what age they are or what their background is or what their diagnosis was, it's something that most people struggle with. And I think when you think about the survivorship, I know it's a bit of a buzzword and some people, you know, it gives them antibodies and they don't like it, but I'm going to use it anyway. Survivorship, that kind of bit where that, you know, a bulk of your treatment's kind of finished for that first time, comes with lots of big challenges for people and a lot of searching on what all this has been about and what it all means. And as you know, I don't need to tell you guys, a lot of things feel different. Emotionally, things have changed. Physically, things have changed. Often perspective on life's changed. And I'm going to touch about that in a bit. And so the normal that everyone seems to want to get back to is kind of anything but normal. And the fear of the cancer coming back is a very big part of that. And I think when people hit that sort of that phase, that survivorship phase, often people think before they hit there, they're going to feel kind of relieved and triumphant and bulletproof and grateful, and they're going to want to meditate all the time and feel very zen about things and have a whole new life perspective and whatever. But actually what happens is a lot of people feel really anxious and really stressed and traumatized and fatigued and lonely and often patronized and misunderstood by a system that says, Bob's your uncle, see you later, off you go. And so we say, what are some of the big fears about when fearing the cancer coming back? What are the big fears about? And I always thought of it like two sort of, there are two arms to this. This all feels a bit weird doing it on a camera, but whatever. And I think a lot of people think it's fear of the cancer, fear of losing our lives to cancer. And yet, certainly, obviously, that's one bit. But it's not just about, will I die from this? If I come back, will I die? That really depends on what your experiences have been, and what you've seen in your life. So some people, at the first time ovarian cancer or any cancer has been seen in their family. Other people have lost parents. Other people have lost siblings or people that they really adored or been through other illnesses. So the context of where you're at in your life makes a big difference. And things like, this is how my leaving my life or being really sick could affect people. This is how it could affect my family. Will I lose control? Am I letting people down? Lots and lots of fears and worries bubbling up about actually, is this going to end okay? But the other side of it, which I think people aren't expecting as much, is the idea of, well, I can't face treatment again. It's one of those things where a little bit of knowledge is a very bad thing, or ignorance isn't bliss, or whatever. Once you've been through it once, you can't pull the wool over your eyes, and you know what it's like, and you take one look at that and think, I'm not going for that twice, thanks ever so much. And so the idea of life being hijacked and the impact on work and finances and relationships and all that stuff is really foremost. So it's not just about, coping with the cancer itself. It's about the whole baggage. When we think about what fuels the fear of cancer coming back, there's lots of things. It's on TV all the time. The adverts, the fundraising is fabulous, but it's all around us. The anniversaries, the celebrities getting diagnosed. There's also a lot of inconsistency that fuels fear of cancer recurrence. So things like who follows cancers up, where. We've got 4 of us here who are speaking tonight from 4 different states, and you can bet your bottom dollar that things are handled slightly differently, rural, metro, different states, different protocols, blah, blah, blah. So all of that stuff can make you feel nervous, as can the idea about how cancers are followed up. And I've called it, I haven't called it. It's called scanxiety. I can never say that word. And it's really that dread, that horrible, foreboding dread. And for some about scans or tests, and for some people that's just before routine reviews, but some people it really builds up for months and months and months, and it's completely debilitating. Other things that wind you up about being frightened of the cancer coming back are all the stupid things that people can say and all the cliches and platitudes. And I won't, go through all of these in the interests of time, but all those things like, oh, don't worry, you've had one baby. One baby's enough. It's fine. Well, it's not fine if you came from a family of 6 and you wanted 5 babies or 6 babies or whatever. Or if you've had no babies and that was something that was really important to you. Okay, you've cheated Jeff, be grateful to be alive. You've got a second chance, so meditate, change the way you eat, stop drinking, exercise. You shouldn't stress so much, really important not to stress. And so all these ideas or whatever that come at you about, I don't know, does stress cause cancer? Everyone says it's caused cancer. And all these kind of myths and ideas and ways of being perfect that are completely unattainable and based on not a lot often, but society believes them and sort of rams them down your throat all the time. And I think often people just expect you to put it behind you and don't worry about you coming back, and you can't. No one can, So I like Aunt Acid. I don't know if any of you have come across her before, but she said some very pithy things. And so, of course, we've got to remember not a lot of the way you feel after cancer is actually about some of the feelings of others and taking on their baggage and ideas. So obviously I'm touching on things very briefly, but I wanted to touch on kind of about 5 or 6 things that I think have been helpful to putting it all back together to try and help them and help cope. The first thing, information is power. And if COVID has taught us anything, I think it's and I suppose it's taught us a few things we weren't expecting, but one of them is information turns out to be pretty important. I saw this clip today actually, and it said, "I never thought I'd be putting more alcohol on my hands than in my mouth." Anyway, the first thing we need to do with information is make a plan. So for your particular situation, ask if there are things that you can do to reduce recurrence and what surveillance you need is right for you. Because you might be in a support group, you might be sitting next to someone in the weight room who has a totally different situation, so have circumstances and different treatments, and so therefore is in different follow-up. And it's that stuff that can really send you wobbly when you don't need it. So talk with your medical team about what you look out for and anything you can do. And the symptoms to look out for, it's difficult, and it's particularly difficult for some cancers, and ovarian cancer is one of those cancers where a lot of the ways is just normal body feeling and normal being a woman actually changes. We change sensations all the time. We still feel stuff in our abdomen and our bowels and other places all the time. So it's actually really quite difficult to work out what's important and what's not. And so, but what I find a lot of people do and women do is they will start really focusing. For example, I've called it cancer of the pinky toe, but people may get, a terrible pain in their top of on the top of their neck or in their arm or something, which is probably because they've been gardening or, I don't know, doing COVID baking or whatever, wherever we're doing. And it's actually overuse, but you just start jumping at shadows all the time. So if there are things you need to be aware of, then be aware, okay? Oopsie, hang on, what am I doing? There we go. So communicating with your treating team is super important, and be open about how you feel, but also we all know you've got a short period of time with the doctor, so we haven't got 25 minutes for a long explanation about how you feel. To actually say, I'm really frightened of the cancer coming back, it's playing on my mind all the time, and I want to talk to you today about this, 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 and this, and my priority is this and this. Because you focus the doctor, and they're kind of like, okay, they thought they might be covering this, and you're knowing, this is what I need to cover. Otherwise, you finally wind yourself up into saying what's important, and your 15 minutes or whatever is up, okay? Or you get the different registrar every time and you feel like nobody particularly knows you or whatever. So don't let fear and avoidance stop you getting information. Make sure you plan for your appointments. And same with your GP. We get quite anxious going into these appointments, so put a bit of effort in. And your GP is really, really important. So finding a GP you trust is really important. And GPs vary widely. Some, and often people have lost a lot of trust in medicine, delayed diagnosis, or people that have said, no, it's all normal, you weren't sent for the appropriate tests or whatever. It's easy to lose trust. So getting a GP and a team that you trust is really important. And if you don't trust your GP, keep working around until you do find one you can communicate with that works well. A good GP is not necessarily one that sends you off for tests every 5 minutes, though, because that is something else that can escalate a lot of fear. And so you kind of want the GP that can be solid and sit with you and test when you need to test, and you learn to communicate, because the road is long with managing fear of recurrence. We can't jump at every shadow in the first couple of months. But having said that, we've got to be realistic. There is no certainty, and I know a lot of people will ask me and ask our doctors, I just want to know, I wish I had certainty. Isn't there a test? Isn't there a scan? Can't you tell me it's cured? Why won't you use the word cure, etc.? And it's really frustrating. It's not done in medicine. Actually, we've got one of our beloved medical oncologist who's retired, and for about the last 6 weeks he was delighting using the word cure everywhere, because he was just getting right into it and thinking, this is good, I can sort of say this now because I just want to be able to say it in my career. But really, doctors can't be specific. But it's not the first time we've lived with uncertainty. Oh, there we go. So other things we can do is make sure you take control with other people's horror stories. And I always say it's just like when you're 8.5 months pregnant and everyone tells you their birth story and you really don't need to know it. It's a bit late at that point. having cancer is a bit like that. Everyone's got a theory, everyone's got an alternative or complementary medicine they want to recommend, everyone's got something they read about on the internet, everyone's got someone with a story that might have started well, but it always ends badly. Okay, and you can see them digging themselves deeper and deeper into this quagmire of crap that they're going to be saying to you. So just cut them off at the pass. Only listen to stories with happy endings. Thanks for sharing your story. I know there's a lot coming at you, but I just want to hear about what's been happening with you. Don't feel you owe people information, or you have to, with their head nodded on the side, looking sage-like and pitying. If that freaks you out and sets you off, just take some control. Get phrases that you like, that you're comfortable with, and start using them. Equally, if someone's newly diagnosed and they're leaning on you a lot, well, then it's okay to say, to put some limits on that. Okay. So that's communication with other people and getting information. Nurturing your body, yes, it's important. But also I think you have to be sensible here. I often use this phrase saying, think of yourself as a diamond, cut some bits which are not helpful, but most of it just needs a bit of a polish. And putting lots of pressure on yourself to do everything in extremes means that it's very difficult to sustain. So get yourself into habits. Look, mindfulness, meditation and other things are marvelous. Obviously, good nutrition, exercise, all those things we know we should do. We know we shouldn't have sat here and done 15 extra COVID kilos because it was really interesting eating chocolate while no one could see us. But we do it. Life's like that. But every now and again, do a stock take, and don't think about it from a cancer point of view. Think about it from a well-being point of view. What makes you feel good about you and in your body, and go for that sort of point of view. And you can't be awesome all the time. It's just not possible. Okay, so just try and do what you can do, and tomorrow's another day. Okay, thoughts and feelings. Cancer changes how people view life. Normally, it's a normal response. You might feel very disconnected from other people, as if they don't understand you, as if you're not on the same page, just totally different book. Your roles are changed, and it's all right to grieve those losses. And there's this phrase I love by Patricia King, who most of you may have heard of, or some of you may have heard of. And she talks about fluffing your emotional pillows. And I always love that phrase. And I think, yeah, we need to do that when you've been through what you've been through. A lot of perspectives can change. I actually see a lot of relationship breakups in my job in this phase after treatment, and divorces and separations are high. And this girl says, while she's getting herself ready for dinner, she says, now I think of it, I think I'd look better without you. And she's not the only one that does that in relationships. So if you've been struggling, you don't have to keep up struggling. You can make choices. I also talk about balancing up a seesaw of stress. Thinking about all those things that load up on you, relationships or chemo or fear of the cancer coming back or stuff you're unhappy with work, or the fact you don't like aspects of your appearance, or whatever it is. And then the good stuff. Look, this whole seesaw thing is way out of whack at the moment. But think about your personal seesaw and make sure you get enough on the good end. Going to flick through that. So getting enough on the good end means thinking about what matters to you in your life. And I use an example of a dartboard. And when we're hitting the bullseye, we're living a life doing stuff that matters to us. And we all spend our time doing a whole lot of stuff that doesn't really matter to us. And I think times like this is a good chance to do a stock take. Why values matter so much to help fear of recurrence is because a lot of the fear is actually also about, is what I'm doing now enough? Am I with the right person? Am I in the right job? Am I okay? If I were to lose all of this for cancer or for whatever reason, anything in my life, has it been okay? And if it's not okay, and we know that, there is a sense of constant disquiet. So making this a really good catalyst to go, you know what, I count, my life counts, I want to do it well, this is a good chance to do that. And it helps bring a lot of peace actually for people. Remember as well, this is not the first time you faced uncertainty. It's rubbish that you have to have uncertainty to feel calm. You don't. If you've changed jobs or been divorced or moved countries or had children or not had children or any of the things, the major events in life, you've been in a period of uncertainty. We're all in a period of uncertainty at the moment. Okay, we've done it one way or the other. We kind of had to. So think about what's worked for you before. Draw on that resilience resources. What brings you joy? Where do you like to put your energy? Who can you turn to? Who sinks you down? Who floats you up? Think about those resources before, because that's what helps you feel less frightened now. Last minute or two, I just want to talk about challenging some of the really unhelpful thinking. And obviously this is something that we can talk about for hours just as a topic in itself. But lots of really unhelpful, destructive thoughts like, I'll never have another relationship, I'm damaged goods, there's no point in stopping smoking or drinking because it's not going to make any difference, I'm never going to be the same again, sex is never going to be part of my life again, I've got nothing in common, blah, 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 blah. All that horrible, negative, squidgy, horrible muck in our heads, and a horrible critical voice. That some of it is normal, this much is normal, this much not normal. Okay, so we all need to be able to deal with unhelpful thoughts in our heads, because it's not actually these awful mountains about, chemotherapy and all that we conquer. This is the hard bit. This is the tough bit in any challenge. I'm just looking at the time, so I'm not going to focus on that because I wanted to show you a couple of resource books that I like. Often we struggle with the same thoughts. And I often use this phrase which says, don't wrestle. Think about your thoughts as a pig in mud. Don't wrestle with the pig in mud, because you both get dirty and the pig likes it. All that's going to happen if you wrestle with your thoughts is you get twice as many and twice as filthy and you're twice as unsettled. This book here, I don't know if you can see it, it's called The Happiness Trap by Russ Harris. Some of you may have come across it. And there's also The Reality Slap. It's a good resource. Have a look at that and you'll get a better idea of what I'm talking about. Another book about living, this has got a good title, hasn't it? How to Live a Good Life. That just makes you want to buy it off the shelf. I didn't write this or anything, it's not like I'm in a marketing campaign, but it's a good idea. It talks about connectedness, it talks about community, it talks about other things that help fill up our buckets of life to help us feel good. Mindfulness is good. This bloke said, didn't come up very well on the screen, but the guy says, can I call you back, Ed? I'm just trying to be in the moment here. Being in the moment, we know, helps. There's good evidence for it, for all sorts of well-being. And you don't have to like the particular moment you're in. You can change your moment. That's okay. Other things that can be destructive are things like expectations. You don't have to take on every expectation that people gave you. And we need to realize that. And part of working with your thinking or getting professional help to manage your thinking is realizing that your thoughts and assumptions and ideas and beliefs, we all have horrible, mucky ones that aren't helpful. Okay. I might just talk about professional help just quickly to say, as I leave my last slide up. Look, professional help can help, obviously. I think of it a bit like a pyramid, okay? A lot of the time, most of us just need to talk to someone, feel understood, be part of support groups, reach out, talk to our friends, do that stuff. There's some people in the middle that need a bit more help, a bit more counselling, thinking about, online stuff, reading self-help books, whatever. And then there's the pointy bit and the bit of the middle bit, which is about, I'm distressed by this. I get panicky. I hate tests. I don't cope. I don't sleep. I've got other issues, got relationship problems or depression or whatever it is. There's help in all the public hospitals and the private systems to deal with that stuff. Okay. My last one, I call the little acronym of I just made this up. It might be complete rubbish, but I quite like it. So I call it Courage to Shine. And it goes through each of the bits and pieces that you can think of while you're trying to manage fear of recurrence. And obviously, I can't talk them all about in detail now, but it gives you a bit of a roadmap to kind of reassure you, I guess, about this can get easier. And it does get easier. So I might hand that back to you, Vanessa. Hope I haven't gone on for too long.
No, not at all. That's perfect. Thank you so much, Dr. Gilchrist, for that valuable presentation and so much great advice. We've just got one question at the moment. and it is, I'm worried I'll never find this any easier. How do I make myself stop thinking about it, about the fear of recurrence?
Oh, look, I think that's something that most people feel, actually. They're frightened of the cancer coming back in the beginning, and they feel like that intensity is going to be there all the way through. And actually, this is a big generalization, but you tend to find that at least after the year or so after finishing treatment, and I know that can seem like a very long time, but for a lot of people, it does start to come down, and it doesn't come down like this. You'll be thinking, oh, I'm not doing too badly, and then something will happen to trigger you, or it'll be scan time, or a celebrity will get diagnosed, or one of those triggers I was talking about before. That is normal. Okay, so think of it like the waves on the shore. Sometimes you're in the beach. Not that any of us have done that for a while, but sometimes we've got to bob over the waves and we're okay, and we get into a rhythm. And sometimes one just goes over the top of you, even though you thought you were in control. That's normal. So I think one of the awful things is people really want to get rid of thoughts, and getting rid of thoughts is almost impossible to do. It's like me saying to you, whatever you do, do not think of a blue giraffe. Try really, really hard not to think of a blue giraffe. And of course we can't, because our brains, it's just like touching wet paint. Once we've thought about it, we go over and over and over it and rehearse it. So trying not to think something tends to make it worse, but actually learning how to have it there, but you don't have to struggle with it. It's the fear of cancer. Yep, it shows up. Whenever someone talks about cancer, whenever you see an advert, there it is. Yep, I feel frightened. It's not a nice feeling, but it passes like a wave. I know it always passes. Okay? And each wave over time gets a bit less intense. So actually having an expectation that you can kind of sit next to it and, be reluctant, neighbors with it is a much easier strategy than trying to think, I just can't think about this stuff. I've got to get it out of my head. And don't let anyone else tell you need to either, because that just makes them feel better, but not you. You'll do this in your own time.
That's great. Thank you so much again, Dr. Gilchrist, for giving up your time and presenting on this webinar.